I'm Rachel. I'm one of the dental care professional advisors here at the DDU. If you receive any criticism online, it is important not to act with haste. There are numerous things to consider when responding to online criticism. One of the main points is patient confidentiality. We need to make sure we're abiding to GDC standards and GDPR. If a patient leaves a review and leaves their name, we do not have the right to comment on the patient or the case. Doing so would put us in breach of patient confidentiality. If a patient leaves an anonymous review, even if we clearly know the patient and the case, we can still not comment about the case. We appreciate it might be frustrating to receive online criticism and upsetting at times, but if this does happen, contact us here at the DDU for advice. If you receive a negative online review, the practice can normally follow their social media policy, but in the first instance, the practice manager can send a polite message to the patient, just asking them to contact the practice and to discuss the matter further. Contact us here at the DDU for advice, ideally before the meeting takes place with the patient. If a patient tags you on social media, it is probably better in the first instance to make sure that your profile is set to private, as this could avoid this. But if you do find yourself in this situation, you can either ignore the tag or have it removed. If a patient sends you a direct message on social media, if it is through your professional account, it would normally be acceptable to direct them to the practice manager who can support them with their queries. If it is to a personal social media account, it would probably be best just to explain that unfortunately, due to the practice's social media policy, that you would be unable to engage with the conversation, or again, to direct them to the practice manager who can help with any queries. If a patient sends you a direct message on social media that's inappropriate, we would advise you to ignore it, and if it persists, then speak to your practice manager and look at your practice policy with regards to inappropriate behaviour from patients. You can avoid criticism from patients when you post about your social life online by making sure you have clear boundaries. Use your professional social media sites to post your dentistry, and use your personal social media sites for your personal life. It is important to ensure the privacy settings are set to the highest settings, and be careful what you upload. So this could be videos, photographs, personal views. Remember, you have your reputation to uphold and the reputation of the dentistry profession.